If you suspect tight hips as the cause of your lower back pain, you're likely right. Tightness in one or both hips causes you to substitute what should be hip movement for movement in your lower back. And over time, especially if you've had a disc injury in the past, this can be very problematic for your lower back in the way of pain as well as stiffness and tightness in the muscles around your back. But before we dive into the fix for this, here's the disclaimer. Now, I know you're ready to jump in and start loosening up those hips, but first it's important to understand where the hip tightness comes from. Now, if you guessed it's doing a lot of sitting, then you're on the right track, but that's not the whole picture. You see, we humans tend to get into routines. It saves us time and brain space to do so, but as far as the hips go, it likely means that there are some motions you get a whole lot of and others you get much less of. For instance, for the hips, you likely sit in chairs a lot with your hips and knees at roughly right angles. And then you also likely walk or stand a lot, which when you put those two things together, or three things together, that's not a lot of variety for your hips. But maybe you also work out, take Pilates or practice yoga, and you're thinking you get a pretty large variety of hip movements. In fact, maybe you're practicing exercises that are meant to improve hip mobility. But the reality is, in all likelihood, you're outsourcing hip movement to that vulnerable place in your lower back, which means that the very exercises you're using to improve hip motion may be, at least in part, the cause of your lower back pain. So to start resolving all this, I'm going to give you 3 hip mobility exercises that you can start working on daily. But I want you to practice them slowly and deliberately and really pay attention to where you're moving from. Be sure that you're moving from the hips and not from your lower back or your knees. Number 1, half kneeling stretch. This is one of my favorite hip mobility exercises. You want to be sure that as the pelvis is gliding forward, the motion is coming from your hip and not from your lower back. Number 2, cross leg or figure 4 stretch. Now, this can be done seated in a chair. Yeah, I get the irony there. Or lying on your back with one leg crossed over a bent knee. Just be sure as you bring the legs in for the stretch or as you flex the hips, bend the hips for the stretch, that you're truly hinging at the hips and not just rounding your back. Number 3, hip rotations. You can sit up on a small pile of cushions or even a low stool if you find that your hips and lower back are very tight, but you want to be in a position where you can sit up tall, you're not having to round your back, and you can freely move your knees from side to side. Be sure you choose a range of motion that feels good. It should never hurt, and make sure that motion is coming from the hips and not from the lower back or from the knees. Remember, none of these exercises should ever cause pain. Practice them daily for about a week and you should start to notice that your hips are getting looser. Moreover, as you start to build your confidence in identifying where hip motion ends and lower back motion begins, you can start to resume those exercises you were practicing in the gym or in your classes that are meant to help you improve range of motion at the hips. All right, now if you found this helpful and you'd like to learn more about how you can use movement and gentle exercises to resolve your back pain, click the link in the description below to sign up for my next free live online workshop, Unlocking Back Pain with Movement, and I look forward to seeing you there.